to make these dreams come. Hello?
Yeah, proceed. We can hear you.
Okay. So our values include integrity, competence, commitment, and innovativeness. We are committed to achieving our objectives. We strive as much as possible to achieve our objectives by reaching out, not just saying the word we want to reach out, but then we organize programs and reach out to the less privileged and those who do not have the wherewithal to help themselves or to attain health services. Okay, so the organization and management. Brindeford Foundation has a structure that desires to keep the program team modest and functional. The Brindeford team is headed by the executive director, who is unavoidably absent today. Who reports to the board of trustees. We also have a board of trustees where we report to, who checks our programs and give them updates of what we are doing. We also have program officers, we have data clerks and community case management who keep record. Those ones keep records of our community case management workers, keep record and supervise the programs manager, who in turn reports to the executive director. So they supervise our programs, our outreaches and everything, and then in turn, they give reports to the manager. All right, so contact points. You can contact us via Facebook, Instagram, and Twitter at Brindeford Foundation. We also have a website at www.brindefordfoundation.org. Our phone number 0708 211 2077. And finally, our address at the Lift Hub, 6A Housing Estate, Calabar, Cross River State. Thank you all for your audience. I appreciate it. Thank you.
Thank you so much, Ms. Kyoto, for that wonderful briefing. We are happy to have you as well. Thank you so much. Thank you so much. So without further ado, we'll be going straight to the next agenda for today. So we're calling on our first speaker, which will be talking on demographic prevalence of hepatitis in Nigeria. Demographic prevalence of hepatitis in Nigeria. So Mr. Gabriel Adim is fully set to have this session, but before we actually call him on board, I want us to understand that this man is very resourceful. This man is resourceful. He has a proven track record of excellence in his work. He has done a lot of things, and I will just be going through his bio for a moment before we proceed. Well, his bio is very robust. We can't exhaust everything, but for you to listen to him, I want you to have a mental picture of who you're talking, who will be speaking to you, and who you're listening to, so you can prepare everything you have. If you're actually being will I say if you are probably a little bit disconnected from what we are doing here, but I know that the sound of his bio will ring a bell and will definitely make you connected. So Mr. Gabriel Etim Adim, born on the 12th of April 1988 from Cross River State, Gabriel studied philosophical science with St. Joseph Major Seminary, Nigeria, an affiliate institute of Urban Political University in Rome. A fellow of leadership and management in health from the University of Washington. Apart from his rich academic background, Gabriel is a development consultant with over 5 years of cross-disciplinary experience in both social development and humanitarian services. Gabriel is a trained and certified project management development professional, PMD Pro, a certified site improvement monitoring system by USAID Virtual Academy. Gabriel also holds a certificate with United Nations Department of Safety and Security, BSAFE. Is certified professional on protection and case management with Corem International. Gabriel is a professional. Is certified on the use of integrated refugees. Please, I beg your pardon. Health Information System, RHIS, trained as Global Profile Registration System by the United Nations High Commissioner for Refugees, UNHCR, So let me just give you the last one, last but not the least, that will just actually blow your mind. Gabriel is skilled on concept notes and grant proposal writing, expert in project design, project management, as well as monitoring and evaluation. Gabriel is the founder of Age Care Development Foundation, a registered non-governmental organization in Nigeria. Gabriel is also a technical director of Capacity Development Associates, Nigeria, where he provides technical development and capacity strengthening to so many organizations in Nigeria. Gabriel is a member of the Nigeria Red Cross Society, Young African Leaders Initiative YALI, and a member of Association of OVC NGOs in Nigeria. He is currently the Resource Mobilization Coordinator for Cross River State Child Protection Network, also the convener of Coalition of Civil Society Action on COVID-19 in Cross River State. So please make welcome Mr. Gabriel Adim. This man is loaded. I have not even gone through his bio. I'm just trying to wrap it up so that we can actually proceed. The man is loaded. He's full of value. He has in-depth knowledge of what health is all about, not just theoretical knowledge. He has practiced. He has held several positions, and it's a privilege to have him. Please, can we kindly, with a digital standing ovation, can we make welcome Mr. Gabriel Adim? Thank you so much, sir, for joining us. We really appreciate you, sir.
Thank you.
Thank you.
Thank you. Thank you. Thank you for having me. This is a very good breakfast for me. Thank you. Thank you, Brentford Foundation, for having me. My work is simple. I'm just going to go ahead to do justice to the topic I was given, of course, to looking at the demographics of prevalence of hepatitis in Nigeria. So my topic will just center on that. So please, can the host enable me to share my screen, or you share my screen from your end? So usually the reason why we are gathered here this morning and today, coincidentally, it's a World Hepatitis Day, which is very thoughtful, that we have to engage ourselves in this conversation to continue to brainstorm on the way forward, because this is one of the public health issues that we actually need to sit back and see how we can fast track and then pull resources together from the government, non-governmental organization, the community, and of course the global community to see how we can bring this pandemic to a halt. So I will just present to you what I have here with me. Okay, so
Susan, have you been able to share your screen, or you need help from my end?
okay, so if you can share, please go ahead.
No, I believe you can share now, so just try it.
Okay.
Assalamualaikum salam. Barka dai. Lafiya kalau wallahi. Alhamdulillah wallahi.
Hello.
Wallahi amin wallahi. Wai ke magana? Na'am. Abdul Katsina. Okay, Abdul Salam. Android ne 7 din number ka wallahi.
Okay, Mr. Muhammad, can you please mute your screen? Please mute your mic, please.
Abdul Salam ya garin ne? Gaskiya ne Abdul Salam. Godiya nake sosai wallahi.
Okay, so can we see my screen now?
Not yet from my end.
Okay. Is it visible now?
Yes, yes, I can see from my end. So I don't know if the rest can see, but I can see from my end.
Okay, so like I said, I was asked to present on the demographic prevalence of hepatitis in Nigeria. This is my name once again, Gabriel Adam. I'm currently the head of programs, Child Survival and Development Organization of Nigeria. I'll be your speaker over the next 15 minutes. So first, before I proceed, these are just my outline, what I am going to focus on today. I'll be speaking on this introduction, what is hepatitis B? And of course, we need to also look at the prevention and the diagnosis, vis-a-vis the treatment and the management plan, after which we'll go straight to look at the demographics. What has been the situation in the last 10, 15 years? And then we look at Nigeria's journey. What are the elimination strategy of hepatitis in Nigeria? And then I will just wrap up from there. So the first I have here is, so many of us do not know. Even when I was doing this research work, I was amazed with some of the things I got to see, that hepatitis, of course, is something that a lot of people are not aware, because it is not as endemic, even though it is, but physically, it doesn't appear to be like the COVID-19 pandemic that we have to put on our nose mask, HIV, where people have to go for viral load and all of that. But let's get this straight, that hepatitis is the most common serious liver infection in the world. It is it is caused by the hepatitis B virus that attacks and injures the liver. This guy is very wicked. He just going straight to the liver and then begin to do some dangerous work there. So it is estimated that 2 billion people, in fact, 1 in 3 have been infected, and about 300 million people are living with a chronic hepatitis B infection. Each year, up to 1 million people die from hepatitis B, despite the fact that it is preventable and treatable. The hepatitis B virus is transmitted through blood and infected bodily fluids. It can be passed to others through direct contact with blood, unprotected sex, use of illegal drugs, unsterilized or contaminated needles, and from an infected woman to her newborn during pregnancy or childbirth. Of course, hepatitis B is a silent epidemic. Like I said, it is not as pronounced as COVID-19 or HIV, malaria, hunger, because most people do not have symptoms when they are newly infected or chronically infected. Thus, they can unknowingly spread the virus to others and continue to silently spread of hepatitis B to other people who don't even know, because it is asymptomatic. For people who are chronically infected but don't have any symptoms, their liver is still being silently damaged, which can develop into serious liver disease such as liver cancer. Okay, so going straight to look at what can we actually do to prevent hepatitis and how do we diagnose ourselves. So it takes only a few shots to protect yourself and your beloved ones against hepatitis B for a lifetime. I mean, this shot, once you are given, it will just go a long way to making sure that you are there, you are protected, and you are secured. The hepatitis B vaccine is a safe and effective vaccine that is recommended for all infants at both at birth and for children up to 18 years. So it is safe for infants to as well have this shot. The hepatitis B vaccine is also recommended for adults living with diabetes and those at high risk for infection due to their jobs, their lifestyle, their living situation, country of birth, religion, and all of that. Of course, since everyone is at some risk, all adults should seriously consider getting the hepatitis B vaccine for a lifetime protection against a preventable chronic liver disease. So these are some of the preventive strategy, of course, which is widely recommended by the WHO, is just to get a shot of the vaccine and you are good to go for a lifetime protection. The hepatitis B vaccine is also known as the first anti-cancer vaccine because it prevents hepatitis B, the leading cause of liver cancer worldwide. Treatment and management of hepatitis. We get to understand here that in most cases when patients are being diagnosed, being treated, the treatment plan for hepatitis B is different from a particular patient. Of course, there are some patients who have a particular approach or strategy at which they use, and then it actually works for them. So usually, it is not everyone who tests positive for hepatitis B will require medication. Depending on your test result, you and your doctor might decide to wait and monitor your condition. So it depends on your immune system. It depends on what is the outcome of your result. Because if your test result indicates that you would be a good candidate for treatment, then your doctor will discuss the current treatment option or the treatment plan with you. So the treatment plan determines how it's going to be. Is it monthly? Will it be twice in a month? Will it be once in 6 months? So the treatment plan varies with individual patient. Whether you start treatment or not, your doctor will want to see you at least every 6 months or at minimum once a year to decide how far you have fared as regards your treatment plan. So before you start any treatment, of course, it is recommended that you make sure you also do your own internal or personal research to look at the various options that are available for you to carry out your treatment plan and ask your doctor to thoroughly explain each option so that you are well informed. It also might be a good idea to get a second opinion from another doctor before starting any treatment, because more information is always better. Once you are diagnosed with chronic hepatitis B, the virus will most likely stay in your blood and liver for a lifetime. So it is important to know that you can pass the virus along to others, even if you don't feel sick. This is very dangerous. This is very, very dangerous. So this is why it is important that you make sure that all close household contacts and sex partners are tested and vaccinated against hepatitis B. While living with hepatitis B can be difficult and scary at first, the more information and support you have, the easier it gets. So this is telling us that, yes, this virus is out there, but it also offers you an opportunity for you to do research to know what can you do, how can you mitigate your treatment, how can you work with your treatment plan. So there are a lot of information out there that you can also make, because once you have this information, it is very easier for you. So many patients become such expert on their own at managing the hepatitis B that they sometimes teach their healthcare providers about the latest research and information available and how it best works for them. Because there are some people, when you come, maybe you want to visit them and give them a particular medication or food or tell them to do this, they will tell you, no, it doesn't work for me. From what I have researched, from my study, this is how it works for me. So it is important when you have this kind of ailment, you can go into research and know more information and then know which care plan and how best it can go for you. The most important thing to remember is that hepatitis B is a chronic medical condition such as diabetes and high blood pressure that can be successfully managed if you take good care of your health and your liver. You should expect you expect to live a long, full life, because sometimes this is something that people will need to step up the health management system by themselves, for themselves, because we cannot allow everything to the government. We understand that we have a very porous system where the government is struggling to make healthcare system affordable, thanks to organizations like Brandford and many others who are making a conscious effort to put this information out there. So a lot of people don't even have information on how they can safeguard and protect, taking good care of themselves. So going forward, we're looking at, according to Medical and Dental Consultants Association of Nigeria, a research work database was collated in 17 states across the 6 geopolitical zones of Nigeria. Of course, this study was conducted between 2000 and 2013. And there are a lot of indices. A lot of data was collated, people were tested, and sorry, the chart might be so tiny, but I'll play on something else. I'll summarize the conversation. They had to go into this study to look at the prevalence of hepatitis in each of the states. So we're looking at the various locations. The states that these studies were conducted include Maiduguri, of course, in the far north. They did it in Jos, Plateau State, Anambra. It was done in Ibadan, in Benin, Edo, of course, Rivers State. In Lagos State was also included in Kwara. It was also done in Nasarawa State, Niger State, Ebonyi, Bayelsa, also in the south, and of course, Abuja was also there. So all of this information was gathered to look at, and it was even done in the urban town city, not even in the rural area, to look at the number of people affected, the number of people tested, and what are the outcome, the indices. So the population there was actually growing. So many people were tested, including pregnant women, including children from 10 years to the number of persons who were tested was between the number of 10 years to 65 years, including pregnant women, were all tested to look at what is actually the indices of this virus as it concerning the health outcome of Nigerian system. And then if you look at these charts, I have to do this summary for us to actually understand what the indices look like. It was very worrisome. So out of the 17 states that were tested, of course, you could see from here, I don't know if you can see my mouse, where my mouse is moving. Let's start from where we have the red color. You see, this is Ekiti State. A total of 4,000 persons were tested positive for hepatitis between that period of time. And then even were 200, in Kano State 300, in Rivers 851, in Maiduguri 308, in Jos Plateau State 1,502, Niger State had 261, Kwara State had 140, Bayelsa had 1,300, and in the whole of this, where you see this color here, the somehow faded sky blue, you see this was Edo State with a total of 12,077 persons were affected as at 2000 to 2013. And then in Ebonyi State was just about 385 persons. Lagos had 219, Nasarawa 500, Anambra 120, Enugu 717, Oyo 592. So all of these were the 17 states that this index analysis were conducted, and we look at, it was very scary when we got to Edo State that a total of 12,707 persons were actually tested, and the result was all positive to hepatitis. So, but then having looked at all of this, between 2000, the year 2000 and 2013, where have we actually been? What has been the journey to the strategy put in place to eliminate this? And then we say in 2018, so that was why in 2018, patient group and members of the World Hepatitis Alliance under the umbrella of Civil Society Network on Viral Hepatitis in Nigeria partnered with the Federal Ministry of Health and the World Health Organization to organize the ever first Nigerian Hepatitis Summit in Abuja. The meeting was one of the flagship events in the country that brought together 26 state ministries of health officials, academia, and civil society groups to engage on ways to accelerate hepatitis elimination in the country. Again, in May 2019, as a follow-up to the summit, the National Viral Hepatitis Control Program convened the first review meeting of all hepatitis desk officers across Nigeria in Abuja again, with the active convened the first review in Abuja again, with a meeting of all hepatitis desk officers across Nigeria in Abuja, with the active participation of all civil society groups in the event. Of course, the meeting was organized to review the hepatitis treatment facility directory and share the best practice among key actors. And then in response to this meeting, to high prevalence rates and in alignment with the global effort towards elimination, the Nigerian Ministry of Health developed National Viral Hepatitis Strategic Plan, which started in 2016 and 2020 last year, which mapped out actions to put Nigeria on the path of hepatitis elimination, national guidelines for the prevention, care, and treatment of viral hepatitis B and C were also developed and published in 2016, which center on firmly establishing the management of viral hepatitis as part of universal health coverage. Again, in 2010, the World Health Assembly adopted Resolution 63.18 to recognize viral hepatitis as a global health problem. In response to WHO developed a four-pronged strategy aimed at raising awareness, mobilizing resources, policy, preventing transmission, and screening and treatment. While 18 countries, including hepatitis B vaccination as part of their routine vaccination schedule, and the worldwide coverage approached 80% in 2011. Nigeria has made notable gain along the four-pronged strategy, for example, by registering hepatitis-related cancer cases, creating national guidelines for prevention and infection in healthcare workers, adopting universal vaccine, and screening all donated blood. However, national policies aim at preventing of mother-to-child transmission and elimination of hepatitis are lacking. This is perhaps reflected in the findings that approximately 14% of Nigeria were exposed to hepatitis B from 2000 to 2013, which of course dangerously places Nigeria then as one of the most affected countries in Africa and indeed the world. By then, the prevalence peaked at 53.9% during that period. So in conclusion, finally, our meta-analysis suggests that from the meeting that was held in 2018 and 2010, the convention in Abuja, so it suggests that there is a sustained decline in the prevalence of hepatitis infection over the last 18 years. Yes. A similar pattern has been observed in other African countries, like, of course, in Gambia, in Senegal, where the prevalence rate 10 to 0.6%, to 18 to 7, and then also 2 to 2%, respectively. The observed decline in hepatitis prevalence in Nigeria may be related to the gradual increase of hepatitis vaccination among children. Of course, in 2002, in the year 2000 through 2005, hepatitis vaccine coverage was reported as 0 by UNICEF, which actually took it to 18% in 2006, and peaked at 41% again in 2013. But fortunately for us, while most recently reported coverage level is low by the worldwide coverage, the impact can be magnified with a rapid reduction in hepatitis B prevalence. This type of response was demonstrated in Gambia, therefore, incremental effort and even small-scale effort aimed at hepatitis prevention and control are likely to have great benefit. So all in summary, all of the meetings, the strategy, the policy, the vaccination provided by UNICEF between 2006 and 2013 till date, there have been a decline from the number usually when we had up to 41% that was actually a peak in 2013, and up to point now it has drastically reduced. So summarily, there is a global impact both in Nigeria, and the effort is actually helping us. Awareness campaign, information creation, and then the more we continue to vaccinate people, the more people continue to have this information. Conferences like this, meetings like this, and then seminars like this, also providing an opportunity, an atmosphere where we continue to advocate, we continue to strive. And of course, this way, where my resources were pulled from, of course, I took some documentation from the Medical and Dental Consultant Association of Nigeria, was the WHO Hepatitis Report, Hepatitis B Foundation, Global Alliance for Hepatitis, and then the Federal Ministry of Health Policy Guide on Hepatitis Elimination. Thank you very much for listening.
Thank you so much, Mr. Gabriel, for that wonderful one, for the wonderful session. Thank you so much. It's indeed a privilege to actually have you with us. All right. So without further ado, I think we have somebody raising his hand for. I think he was raising his hand. I think he has a question or something. So I don't know. Let me. Mr. Muhammad, are you up for a question? Do you have a question to ask Mr. Gabriel? Do you have a question to ask Mr. Gabriel? Okay, can you speak?
Hello.
Yes, we can hear you loud and clear, sir.
Mashallah. Good morning.
Good morning.
How are you?
Yes, just go straight to the point and hit the nail on the head. What's your question for Mr. Gabriel?
My question is that what are the difference between the rest types of this viral infection?
Okay, no problem. That your question will be taken. They'll respond to your question in the Q&A session.
Okay.
All right. Thank you. So we start without wasting much of our time. We are going straight to the next speaker. He's fully loaded and waiting for us to actually usher him in. He will be speaking on challenges in accessibility, affordability, and availability of hepatitis vaccine, a situation analysis. So the person taking this is Dr. Kelly Ola. Dr. Kelly Ola is an alumni of the prestigious Hope Waddell Training Institute and a medical doctor from the University of Calabar Teaching Hospital. He has interest in community medicine, epidemiological studies, and data analysis, and is involved in awareness programs and screening exercises on hepatitis B. Yes, one fun fact about this particular doctor is that he likes money. He likes making money. So I'm going to usher him in as he talks to us about the subject's matter and how we can go from there. Thank you very much. Please, with a digital standing ovation, let's make welcome Dr. Kelly Ola. Thank you so much, Doctor. You have the stage, sir.
Oh, thank you. Okay, good morning, everyone, and thank you very much, Brentford Foundation, for having me here. Thank you for the digital standing ovation. It was well received. I want to say a very big thank you to the last speaker who did a very good job in making us understand the burden about this particular disease and what is being done so far to see how we can understand it, curb it, and then manage it appropriately. In the brief time I have, I'll be speaking to us about the vaccination, which is, for me, one of the most important reasons why we are gathered here, because hepatitis can't wait. Hepatitis cannot wait. So we can't focus on any other thing and then neglect hepatitis B. So the vaccination is very important because, just like the last speaker made us to understand, a lot of people are roaming the street with hepatitis, but they are not aware because it only gives you symptoms at the late stage. It only gives you symptoms at the late stage. And vaccination is one of the most effective ways that we can deal with hepatitis B. One of the most effective ways we can deal with hepatitis B, because once you get infected with hepatitis B and you are allowed to take a long course, you will come down with a liver disease, which will lead to liver failure and can also lead you to hepatocellular carcinoma, which is the liver cancer. And those are very expensive things to treat, very, very expensive. You stay in the hospital for a long time. A lot of things happens to you. So hepatitis B vaccination is Okay, I think I was muted. So hepatitis B vaccination is way better than considering the treatment. It's way better than waiting for symptoms to arise first. Hepatitis B vaccination is way cheaper. I should say that concerning disease conditions, especially hepatitis B, prevention is not just better than cure, but prevention is cheaper than cure. It's far cheaper than cure. One of the problems you have with hepatitis B is, okay, you have what we call ascites, your stomach starts swelling. That's one of the most important things that bring people to the hospital. And for you to effectively deal with that, you're going to be taking expensive medications in a week, spending up to 90,000 to 100,000 to just take care of yourself and amidst the other hospital bills that you are going to take. And the most definitive treatment for liver conditions is liver transplant, which we have not yet gotten a strong foothold of liver transplant in our country. So why don't we spread out the message of vaccination, which people can get for less than 5,000 naira, and that effectively rules out your chances of being transmitted. So the challenges with vaccination, the challenges with accessibility, the challenges with affordability, the challenges with availability, all of these things are going to be discussed year in, year out because of the level of importance our government and our stakeholders place on health. They're going to be talked about every time because we are a low resource country, a third world country where funding is very difficult. There is a lack of appropriate resources that helps us to deal with very important issues. Except everybody is talking about it, except it's biting everybody, nobody seems to pay attention to some certain things like hepatitis B. And just like the last speaker has made us to understand, the burden is very high. The burden is very high. I used to tell people that many of the died after a brief illness that you hear about, many of them are from hepatitis B, because by the time they come to the hospital, it's almost late. It's almost late. By the time most people come to the hospital, it's almost late. A lot of things has gone wrong by that time. So the vaccination is very important. First thing about one of the challenges that we should have had is authorization from stringent bodies, the WHO, and that has been solved already. Hepatitis B vaccination has been authorized. It is safe. And there's a large-scale production of it because of the burden of it. Now, one of the challenges we have is availability where it is needed. And Nigeria happens to be one of the endemic nations of hepatitis B. Endemic in the sense that we have it more than every other part of the country. So Nigeria and certain other countries are endemic for hepatitis B. And it can be transmitted so easily, sharing of sharps from mother to child, through contact with blood, through sexual contact. Even health workers are at risk of getting this disease. So we need it right here. But does it come to us? No. What are the challenges with it? There are a lot of challenges that comes with it, but for the sake of time, I want to narrow it down to funding. Just like Mr. Adip Kojo said that coincidentally, I don't know where he found that out. I don't know where he got it from, because you know a lot of things on social media are fake news. He said that this particular person talking to you likes money, which of course, from your look of things, I'm a very humble man, down to earth. I don't think I like money, but I know and I understand that what money cannot do, more money can do. So that in the same place applies to hepatitis B vaccination. There is a short of funding. There is a short of funding. I will not want to go into all the theories, all the situation, step-by-step analysis in breaking down why we have a low vaccination rate. The most important reason is funding. The most important reason is funding. Funding covers a whole lot of other things. And I will end with the funding. Now, beyond funding, there's a need for support from multilaterals to ensure that there's a timely global access. Now, these multilaterals, even though they say they are non-governmental, some of them say that they are non-profits, we all know that at the end of the day, you need materials to aid in your movement. So the lack of funding limits these multilaterals to ensure that there can be a global access of this. Another important challenge we have with the hepatitis vaccine is the prices, because for a vaccine to have a high rate of usage and affordability, the prices has to reflect public investment. It has to reflect the risks that is shared concerning that disease condition. It has to take into account the large volume of purchases that will be made. And in a country like Nigeria, we need a large number of this vaccination. There's a need for sustainable funding. Like in 2004, when the World Health Organization and the Global Alliance for Vaccines and Immunization in 2004 worked so hard and included hepatitis B in the national program of immunization, so that children that are born are being mandatorily given the vaccine at birth and at other times within their early stage. That was a huge success. That's a huge success because one of the commonest form of transmission is from mother to child. So that was a huge success. But how about the adults? How about you and I? Because I believe most of us here are adults. How about you and I? Where has been that awareness about the need for vaccination? My topic is accessibility, affordability, and availability. But I would like to twist it a bit and say, for hepatitis B, that is not the challenge. The challenge is beyond funding. The challenge is awareness. So we have a good number of participants in this event right now, a good number of participants in this event. And I don't want to do a roll call, but just a rhetorical question. A rhetorical question. How many of us have done our hepatitis B screening? How many of us have been vaccinated for hepatitis B? How many of us have completed the doses? The last speaker said you need just few shots of the hepatitis B vaccine to be free for life from ever contacting the virus. So how many of us are? And I want to believe that most of the people in this conference are well exposed, well educated, and well to do. At least you have food to eat in the morning, you have where to lay your head, of which we know that we are the lucky and 15% of Nigerians who cannot do that, who are thinking about survival more than thinking about drugs. Because if you give a black man, not let me know it's a black man, but if you give an hungry man food and drugs, he will definitely take food over drugs. So there is a need for more vaccination programs. Vaccination programs will solve the problem of awareness. Brindford Foundation is doing a great job. As a result of these programs, which they've started running for this week, we'll see an increase in vaccination. We'll see more people coming to community medicine department to take vaccination. We'll see more people getting screened, and we'll see more people completing their vaccination. And with more people being vaccinated, with more people being vaccinated, there's going to be a reduction in the burden of hepatitis B. So 2 things I came here to emphasize to us: awareness and funding. Awareness and funding. In Africa and in Nigeria, we know that there is insufficient resources to be able to sustain something like this. It's not being talked about every time. And sorry to bring up this issue, we all know the intricate characteristics of management and administration in our country, where every little opportunity is maximized to siphon money. Every little opportunity is maximized to keep a bit of the money. So if the public is not fully aware of hepatitis B, there will be no pressure on the health management and politicians to ensure that there is a large coverage of the hepatitis B vaccination. So as I end, I'd like to give us an illustration. If at the Department of Community Medicine, University of Calabar Teaching Hospital, every day or every week, we have 50 to 100 persons trooping there for hepatitis B vaccination, there'll be pressure on the management to ensure that they go after these vaccines. A lot has been done to reduce the cost of hepatitis B vaccination. From our center here, a hepatitis B vaccination just costs 1,700 per dose, and you need just 3 doses. You take the first dose, The second dose is given to you 4 weeks after the first dose, and the third dose is given to you 6 weeks after the first dose. So after the second dose, just 1,700 each, and it's not more than 5,000 naira, and it's quite cheap. It's quite cheap compared to how much it used to be many years then. But I do not argue the fact that there is a need to make it cheaper. I do not argue the fact that there is a need to make it free. You understand? But now this is where stakeholders like you and I, like Brian Ford Foundation, more people coming together to increase the awareness, to say, no, we need more hepatitis B vaccination. WHO has done their best. These vaccinations are available. These vaccinations are relatively affordable. These vaccines can be accessed, but are we really getting them? I could spend weeks or months at community medicine and department, and you don't find anybody coming to get hepatitis B vaccination. You don't get anybody even coming to screen for hepatitis B. It will shock you to even know that many health workers have not been vaccinated for hepatitis B. Many health workers have not been screened for hepatitis B, of which the health workers are a major risk factors because they come in contact with patients every day. They come in contact with blood and blood products. So they are one of the population that is at risk. But to amaze you to know that there is still a large number of health workers who have not been screened, not to talk of being vaccinated. So even the health workers have a role to play because they are like the mouthpiece to emphasize and really make people understand how serious this condition is. So there's a lot that needs to be done still in the area of awareness. I think the next speaker that will come about to talk about awareness, and that's where we need to talk about it. Can we make hepatitis B disease go viral? Can we make it be that every market woman in the market knows about hepatitis B and has a little knowledge about the dangers of hepatitis B? Hepatitis B can kill, and it kills very seriously. So in discussing about the hepatitis B vaccination, we need to talk about awareness. So government and international stakeholders need to work so hard to increase this awareness on the streets so that we can have more people coming for the vaccination. And then government and stakeholders need to also increase funding for this vaccine so that we can have it accessible and everybody can get it. Thank you very much for having me here. I wish that living here, each and every one of us in our own different capacities, we work hard to see how we can increase the awareness of this vaccination and mobilize funding so that we can have sustainable funding for hepatitis B vaccination. Thank you very much.
Thank you so much, Dr. Kelly. I really appreciate that session. It was really mind-blowing and detailed. It showed that it actually comes from the heart. There's a pain. There's somebody that has actually seen this thing, seen that there are lapses, seen that there are loopholes that needs to be filled. Thank you so much for drawing our attention to it. So I urge everyone here that's participating, if you've not actually gotten, as a stakeholder, if you've not gotten vaccinated, or if you've not tested yourself, let's say we are the lights. We are the ones that people should actually look at. We are the ones to advocate for it. So why should we advocate for something that we are not even participating, that we're not a partaker of? That is duly noted. Thank you so much, Dr. Kelly. We really appreciate that wonderful session. If you have questions, please note it down. At the Q&A session, we'll be taking questions from different angles, from all the speakers, so you can ask questions. And I believe our dear facilitators are available. They've given their time for this 2 hour 30 minutes period. They've given their time. Let's squeeze out what we can get from them in terms of knowledge, information, and education. Thank you so much, Dr. Kelly, one more time. We really appreciate your time. Thank you so much. So without much ado, we'll be going for a short break. This break is just 5 minutes. You don't have to go. You just have to stay with us. All right. So a 5-minute break for you to stretch yourself before we come back and talk about the awareness aspect of hepatitis. The the facilitator is fully loaded, is alert. He has been adjusting his camera since, waiting for the right time to launch, to unveil. So please and please and please don't go too far. Just drink, sip a cup of water, stretch your body and move. Oh, okay. I just got notified now that there's no break. Wow, because time has gone already. Oh, so sorry about that. Then if you're going, please come back. Our guy at the top said there's no break. I have to oblige. All right. So since there's no break because of our time, we'll just have to go straight right to the next session. All right. So I'll be calling on Dr. Idongesit Victor. He'll be speaking on the need for awareness creation and vaccination, biomedical dangers of hepatitis disease. This is very important because we need to know the danger. If we don't know the danger, then how can we even be connected to what we are saying today? All right. So I'm just going to be reading, giving a briefing of who Dr. Idongesit Victor is. Dr. Idongesit Victor has his core values centered on human and community development. He upholds humanistic ideals in high esteem and get towards a just and egalitarian society. Thus, bridging the yawning lacuna in human capacity and social economic development, gender bias and ethnicity or tribalism. Idongesit is a researcher and a PhD scholar at Center for Advanced Medical Research and Training. He bagged MSc in biochemistry, specializing in cancer research and molecular biology from the prestigious University of Ibadan, Nigeria, and BSc in biochemistry from University of Calabar, Nigeria. He is a certified health, safety, and environment management HSC competence level 1, 2, and 3. Highly skilled in ICT, comprising Microsoft Office Suite application, SPSS, which we known as statistical product and software solutions, graph, pad, prism, stata, and statistical analysis. Idongesit is self-driven and highly motivated with sound analytical aptitude. He is passionate to contributing immensely to community-based projects geared towards mitigating or eradicating societal illness, poor access to community health care, poor educational system, poverty, etc. To achieve this, he has served in so many capacities, working with NGOs as research director, program manager, fundraising personnel, grants, and proposal development manager. All right, with a digital stand innovation, let's make welcome Dr. Idongesit Victor. He will be discussing on awareness, and highlighting the key dangers of what, of hepatitis, of the hepatitis disease. So thank you very much, Dr. Victor Idongesit. You can unmute so that we can hear you. You can unmute.
Okay, thank you very much for that, and thank you for the previous presenters. My name is Idongesit Victor, a research scholar at Center for Advanced Medical Research at UDUS. All right, so I'm very much happy to be one of the guest speakers in these inciting topics. Okay, I believe you can hear me, right?
Yes, loud and clear. Loud and clear.
Okay, perfect. Okay, so I'll be talking on very briefly. We're talking on the need of awareness, creation, vaccinations, the biomedical dangers of hepatitis. Now, the previous speakers have dealt decisively on the basic things you need to know about hepatitis, how it has been, the demographics, whatever the challenges people have been encountering and getting access to treatment and so on and so forth. But I will decisively deal on the awareness creation and vaccination as regards to the biomedical dangers of hepatitis. All right. Now, tomorrow marks the World Hepatitis Day, and it's quite keen for us to have more knowledge, in-depth knowledge about what are these biomedical dangers of hepatitis. What are the things that you need to know that will trigger your the aspect of you going out there to make a kind of awareness for people, because it's quite a number of people may not even hear about what is hepatitis. Okay, I'm not going to talk about the different types of hepatitis, viral diseases that exist, but we know the commonest one, which is the hepatitis B, is more prevalent, about 8.1%. Okay, is more prevalent in Nigeria and most in other sub-Saharan countries. But now let's look at hepatitis generally. It's a viral, hepatitis simply means, okay, it has to do with the liver. Titis has to do with inflammation. So we are simply looking at a viral diseases that affect the liver. All right. And when I look at the topic, I was quite interesting because the Blind Foot Foundation has done noble to bring this to the ears of people about the dangers of these diseases, because most people, why are they not keen to subjecting themselves to testing, vaccinations, and treatment? Is because to some extent they are ignorant of the dangers that revolves around these diseases. Because I believe an average man, having been informed, okay, on the dangers of a particular disease, what this disease is likely to do to your system, okay, would easily appraised the fact that he needs to be tested for the disease, he needs to be vaccinated, which is most important, because prevention, they say in science, is better than cure. All right. So what are the basic things that we need to know about this? We need to strategize awareness. Now, this is I will call it a call to action act for every individual hearing me and those who are aware of this the pandemic, the current endemic of hepatitis B. I will not say hepatitis B to be specific. Let's just say hepatitis diseases, okay? All right, so I believe it's a call of action for everyone to take it to the streets, take it to everywhere, to make people know about this. And you cannot actually go down to the street, okay, to talk about this when you've not really been informed about what this stands for, what happened when an individual is exposed to, and that is the aspect that I will be talking briefly on. All right. So now you need to strategize. What we call awareness is getting to the people. It does not, hepatitis diseases is not restricted to some ages, races, or some certain groups of age, sex. No. In creating awareness, it has to be publicized to everybody. Everybody is included. There's no segment to individuals that should be made exposed to what hepatitis disease is all about. It's something that is going to take down to the streets from the grassroots. All right, it's something that is supposed to be made known to everybody. So it doesn't have a barrier to say, okay, these people are most predisposed or these people are less predisposed. So let's say the target audience for creating this awareness, okay, should be every individual. Every individual is involved. All right. So in your awareness creation, you have to target every individual. You don't have a class of people, maybe say, okay, these are not educated. Okay, you now, okay, let me go more to the uneducated people, and you leave the educated. Even the educated people, okay, to some extent, they are ignorant of hepatitis B virus, just like what the previous speaker said, that he works in the health sector, but really even the medical personnel do not embrace this, all right? Because something is this, the secret about it is this, to some extent, they do not understand the clinical implication of these diseases. And most people died of these diseases and they are not tested. Some attributed it to other diseases, but not neglecting the fact that hepatitis, okay, is a disease that has so many complications, all right? And we are going to talk about that in a brief. Okay, so the essence of creating awareness on this and vaccination is to make everybody, let people understand the basis why this must be known, all right? And those are the things that will help individuals to embrace, okay, to key into getting himself tested, vaccinated, okay? Because when you are vaccinated, sometimes some people have this fear of vaccination. When they hear vaccination, they say, no, you are going to introduce a kind of foreign substance into my body. It might have this, it might have that. So they might have this kind of misconception about vaccination. And at the same time, it is awareness that will actually bring to the notification, to the level ground knowledge of everybody, the need, okay, to be vaccinated, the need to be tested for, and if found positive, then treated. All right. Actually, I wouldn't say treated, it can be managed, it's better. All right. So now, what are the strategies? I've just mentioned the strategies of creating awareness. All right. There are so many platforms of creating awareness to people, of which one of them is what the Brian Foundation has actually showcased. Okay. So, but now each of us individually has to take it to the street. Tomorrow is the World Hepatitis Day. You take it to your street, take it to your workplace, take it to your home, take it to your local area, okay? That is where you have to start your awareness, okay? Start it wherever you are. Let people understand about hepatitis B. Hepatitis B, hepatitis diseases is real. It's not a fiction, it's not a misconception. It's not like other diseases that some people attributed it to be a kind of a politicized disease. No, hepatitis B is a viral infection that affects the heart. It inflames the heart. And verily, you must understand that in the biological system, without the heart, everything is set to go derail. Because why? Everything that goes inside the system, okay, goes through the heart. The heart is an organ that acts on every substance, both xenobiotic and known to the system. They carry out the metabolism, they break down, they decide what happened, right? So if your heart, your liver, per se, is the liver I'm talking about now, okay? If your liver is not in a functional state or is in a conditioned state, then certainly such individual has more to do with life and death. All right. So the awareness aspect and creation aspect has to be taking it to the people, let them know the morbidity and the mortality rate of people that are facing, and that aspect has been dealt with the previous presenters. Okay. There's a high increased rate of hepatitis diseases. All right. This disease actually exists. Now, when you establish that fact, okay, now in the strategies is this, you have to come down to their level of understanding. All right. That is why I made it known that you don't segregate to say, okay, this has to be for the learned and this has to be for the unlearned. Okay. So you have to draw your roadmap map in that it can accommodate all individuals, both illiterate, non-educated women, and so on and so forth, all categories of people. You need to let them know, come down to their level of understanding, come down to their level of grammar, possibly use their common local language. This is one of the strategies of getting people's attention. Okay, you have to come down to their language of understanding. All right, because this is not an aspect of showing what you know, but is an aspect of impacting on people. So you have to come down to their level of understanding in passing the information. All right, so it hits the roads tomorrow. All right, even here in Udus, there are some sensitization programs going around, one of which I really embrace what the Brian Ford Foundation is doing. So one of the strategies is that locate your location, locate the people, all right? Use the common language that is best explanatory to them, that they will be able to embrace it and absorb all the information. Don't just communicate with them in a language that they do not understand, all right? So that is the awareness aspect. Now you have to create that. So those are the strategies you need to use, okay, in creating an effective awareness. This has not ruled out that hepatitis B awareness has not been in previous years. There has been, but maybe it has to be more aggressive. All right, more aggressive in the sense that it has to go down deep to the level of understanding to every level of education. Okay, let's put it this way. Let me give you a kind of rundown step in creating awareness or any treatment or any public diseases that you want people to be aware of. Okay, you need to go down. First of all, you need to identify your target audience, understand their level of understanding. All right, understand they are pre-informed. Hello, I'm having a kind of break. I don't know if you can hear me. Hello. Okay,
it's going well now.
All right,
it's going well now.
So okay, it's going well now, right?
Yeah.
Okay. identify your target audience. Once you identify your target audience, understand their level of understanding in terms of the source of information you are going to pass through. All right. So you need to know the language of communication. Is it best interpreted to them in the way they understand? If yes, okay, that's a major tool. And there are so many illustrations that you will take around to be able to communicate the information, because most people learn more with what they see. Okay. So you have to design some certain tracks and certain things that will help to communicate the creation. All right. Now, the awareness creation is to go deep to make them understand the need, okay, of vaccination. Some people don't even understand. They just take, I'm not sick, so vaccination, why would I take vaccine of anything that I'm not sick of? All right. So you need to go down to make them understand the need of vaccinations, what this vaccination does against what hepatitis diseases. Okay. So once you're able to establish this awareness aspect of it, and you communicate to them in a language that this disease exists, the next thing is to make them know that failure, or if they don't adapt to this information or they don't inculcate this information you are passing through to them, okay, these are the possible dangers that they are exposing themselves, their families, their loved ones to. All right. So it's not just creating the awareness. You create the awareness that this disease exists. At the same time, you need to establish some fact that if some preventive measures regarding this disease are not, are not checked in balance, okay, that there is what we call, should I say, the biomedical dangers, the dangers of it. And one of them we can talk about grouping it categorically under the rate of morbidity, all right, and mortality. And at the level of morbidity, we'll be talking about the diseases, the further complications that can happen. How does this work in the system? What happened? That if you are not vaccinated against hepatitis, all right, and you don't know your status about hepatitis, all right, because early detection offers a better management than at the late stage, all right, then you also go in down to summarize on the aspect of mortality, which we will now be looking at the clinicals and biochemical features of it. All right, now let's look at it. We've been talking about hepatitis. You need to let them understand that hepatitis disease has to do with which organ. Hit it is the liver. Now you let them understand. Now I'm going down to the biomedical dangers now. All right, you let them understand the important roles of the liver to the system. All right, the liver plays the critical roles in the biological system. It offers it's a major organ that metabolizes every substances that comes into the system. But quite unfortunate, it is this organ that the viral hepatitis affects. All right, now once you are able to establish that fact, that they understand, okay, my liver is affected, and this is the functions of my liver. You let them know that it is the liver that does almost all the work that the biological system requires. It is the energy organ that metabolizes everything. So there's a consortium that always say that, okay, the symposiums talked about that whatever you take in, how that thing reacts in your system, how longer it stays in your system, and what are the possible routes, okay, that it gets out of your system, okay, that determines how you live longer. So, okay, so we are talking about the awareness, its impact on health management. All right, so you've picked up the organ. We know that the organ that is mostly affected by this hepatitis is the liver. All right, and I've just clearly stated out some functions. The basic is just a summary. You don't need to go down to, blow them with grammars and all of that, okay? And you yourself need to understand what the liver does in the biological system, just like I've stated. It detoxifies the system, okay? It helps to prevent the system against noxious substances, okay? It plays a lot of roles in metabolism, all right? It plays a lot of roles in everything that has to do with the system that goes through the blood. All right, so those are the basic things you need to know about that. And second thing, after establishing the organ in which this is affected to, you need to go down to talk about the aspect of what does it do. Now, this is a virus, okay? Now, a virus becomes very active and very virulent once they enter the host. So what the virus does is this: it gets into the system and inculcates its own genome into your own genome, all right? And thereby influencing whatever product that your normal genome is supposed to produce. They alter it and they now produce any other thing that is not biologically functional to the biological system, and that results in so many clinical features that always manifest in hepatitis virus. So I'm going down now to talk about the biomedicals. Okay, what I mean is this: if you are not vaccinated, okay, and you are exposed to, okay, previous studies might have talked about the transmission, the route of transmission. Of course, it varies depending on the type of viruses that is prevalent in some countries, but the major one in like hepatitis, we talk about the sexual transmission, you talk about person-to-person contact, you talk about sharings of, is a virus. So it can get infected on the basis of other viral transmission. All right. So it gets through body fluids, it can be transmitted through several body fluids. That aspect must have been taken care of. All right. So now, once you are not vaccinated, okay, and you don't know your status as regards treatment, this is what is going to happen. This is what you are exposing your liver to. This is what you are exposing your organs to. And by so doing, you know that you have subjected your liver, your tissues to some certain damages that will result in myriad of certain pathological conditions. All right. So after then, you need to know, I've talked about the liver, I've talked about how it got into the system. How does it manifest its clinical dangers? Is this, it gets into your system, is a viral, is a single-stranded DNA. So it got inserted into your own genome, into your own DNA. And what does it do? It influences the productions of certain proteins that your body produces to keep the body immune system strong. So what they do is once they get into your system and they get incorporated into your genome, they now produce their own like proteins. And these their own like proteins counteract the normal biological system. They fight your immune system. All right. And that happens in the liver. They attack the liver, and that results in what? Hepatitis. That is viral inflammation of the liver. So anybody that is not vaccinated and does not know the status of his hepatitis, you are exposed to these damages. All right. If you are vaccinated, what the vaccine does is it gets into your system. Once it gets into your system, it pre-planned your system, or you pre-position your system on a particular standard whereby wherever you get exposed to these substances, your immune system have already developed some immunological response that will attack those viruses. But if your system have not been pre-exposed, okay, pre-structured or molecular structured, okay, to have a kind of adapted immune system against this virus. Once this virus hits you, it attacks your liver. And as it attacks your liver, one of the major diseases is what we call it will lead to liver cirrhosis. All right. Now, apart from liver cirrhosis, okay, these are the clinical dangers that I'm talking about. That if you're not vaccinated, you take it lightly. It's not my thing. It's not something you need to go down to let them understand these dangers, okay? That you are exposing your liver, and not just the liver, because if your liver is affected, certainly there are other complications that will affect other organs of the body. And these other organs of the body play vital roles in keeping you alive. In any dreams you want to succeed in life, the biological system, health organs are of key priorities. All right. So now, that is for the inflammation of the liver. And apart from it, does not just inflame the liver, it also predisposes the liver to what we call hepatocellular carcinoma. That is cancer of the liver. Why? Because this viral genome can incorporate their genome into your own DNA. And once they incorporate their own genome into your own DNA, they causes mutation, which is the hallmarks of cancer. All right. Now, when they cause this mutation, they dysregulate the activities of the normal cells in proliferation. So you see that the cells tend to misbehave, and they adapt this kind of what do I call it, gamalionic nature, whereby they are not susceptible to some anti-growth signals. Okay, they behave like they are self, they do what they want to do, and that results in what? Cancerous cells. Okay, so most of the hepatitis of various strains, okay, we have the A, B, C, D, E, and in fact we got to F, although EF has not been fully identified. All right, so most of these hepatitis diseases, you have to let them understand that the awareness is not just for you to know that this disease exists, but this disease has its complications if an individual is exposed to this disease, or if an individual has already been exposed, okay, and he has not been taking some medication or treatment management measures, okay, to reduce this viral load. Because one of the strategies is this: viral replicate rapidly once they get into the system. And that is the root of all these biomedical complications. As they replicate more, that's what I mean, reproduce, okay? As they reproduce more, all right, okay, I have a few seconds to round up, okay, that's nice. So as they reproduce more, I'm almost rounding up. So as they reproduce more, they cause several biological damages in the system, okay? And one of those biomedical dangers is that it exposes your liver to damage, liver cirrhosis. I've talked about liver cirrhosis. I've talked about hepatocellular carcinoma and inflammations of other organs, because if your liver is affected, it sets complications to other organs, which affects your kidney, because what happens is the liver will not, how does it affect your kidney? Your liver will not be able to metabolize substance that comes in because it's being exposed to inflammation. So those toxic substances moves to kidney and result to kidney stones, it results to so many kidney failure. Apart from the kidney, it affects other organs, it affects the heart, because the content of the blood cannot be filtered if the kidney cannot work functionally, all right? So these are the factors you need to understand. These are the dangers of not being vaccinated and the dangers of being away from vaccines. And you talk about the treatment service, there's other antiviral drugs, and what this antiviral drug does is just to go and reduce the viral load and inhibit the activities in the biological system. So this hepatitis virus has been implicated in so many diseases, apart from cancer, liver cirrhosis, and those are the major ones, but they are implicated in so many diseases. So I believe that with this, you'll be able to communicate more, you'll be able to come to understanding of the biomedical dangers of being exposed or not being vaccinated against what hepatitis diseases. All right. So I believe in subsequent time, subsequent lectures, I believe this will be able to add more knowledge to your world bank of knowledge to understand that there is need for creations of what hepatitis awareness for vaccinations, and also you'll be able to go down to understand the biomedical dangers that are involved. All right, both at the morbidity rate stage and at the mortality stage. All right, so these are the common parameters that we can look about in considering biomedical danger. So you look at the biochemical aspect and you look at the clinical aspect, but it is the biochemical aspect that predisposes to the clinical aspect. All right, so that is all about what you should know about the biomedical dangers, because when you're talking about the biochemical measures, you'll be looking at what are those parameters that are affected. And all these tests that is being done against hepatitis look at the liver enzyme biomarkers. It means that it is the liver that is affected. If you go down to the clinical symptoms, you see that it boils down to the liver. So your liver is at risk. And when the liver is at risk, believe you me, that all other organs are at risk, because the liver cannot work, all other organs will be affected. So thank you very much from Brian Foundation. I believe this will do so much to communicate to you. Thank you so much.
Thank you so much, Dr. Victor. This is really, really, really mind-blowing. We in fact, the information is too much. We can't exhaust everything, because I noticed that Dr. Victor has won his gamut of fire. He was just dishing. So I really appreciate. One thing we should know from what he has said is, don't be ambiguous. Don't be ambiguous when you want to communicate when you want to communicate hepatitis to people. You want to create awareness about this. Make sure that you explain it in a way they can understand. Don't join a lot of medical terms together, and before you know, these guys are confused. They don't even see. They will say, no, this one not fit do me. Because if you want to look at it, we are going grassroots. We are going to those that actually needs this stuff. Everybody needs it actually. So don't be ambiguous. Just make sure that you communicate in a language that they can understand. So we are really, really, really behind time. So we should just try to hurry. Next speaker is 15 minutes, and let's see how we can actually manage that time that has been allocated to us. And let's see how we can also give out our best. All right. So the next speaker will be talking on the role of the government and NGOs in assisting and providing support to local NGOs in hepatitis awareness, screening, and vaccination programs. So we'll be having on board Dr. Anoka Joseph, Dr. Anoka Joseph will be taking us on this mind-blowing session. So without wasting much of our time, I'll just tell you who Dr. Anoka Joseph is. He's a simple man, a seasoned leadership expert and public speaker. His passion for mental health, infectious disease, and research has driven him into creating systems for mental health. He's a medical doctor from the University of Calabar Teaching Hospital. So we have 15 minutes, Dr. Joseph, we know our culture. A standing digital ovation for Dr. Joseph. Joseph, let's put our hands together as we invite him on board. Thank you, Dr. Joseph. It's a privilege to have you with us. Thank you so much. Thank you so much. Thank you so much.
Yeah, thank you very much. I am excited being here. I want to thank the foundation for giving me this opportunity to talk about this. Okay, can you hear me? Okay.
Loud and clear. Loud and clear.
Right.
Okay, so I'll be speaking very briefly on the roles of international NGOs and the government in supporting local NGOs in providing awareness, screening, and vaccination programs. Just like as our previous speakers have spoken, hepatitis is a very serious disease condition that is very common, especially in Nigeria. Okay, studies have shown that about 60 million Nigeria, there are about 20 rated on this point. Okay, and so if we want, I'll just go straight to the point, looking at the role of NGOs, international NGOs in supporting local NGOs in providing awareness, vaccination, and then screening. Just like we have heard, the awareness ratio of hepatitis in Nigeria is very low. Same with the vaccination status of a lot of people. It is even low. Studies have shown that less than 30% of health workers have been vaccinated against hepatitis, especially hepatitis B and C. We in the health sector, we see a lot of cases of people with hepatitis, and usually they come down when they are at their terminal stage, which is very quite serious. Okay, now what are the roles of these international NGOs and the government? First of all, I want to talk about the areas of awareness, beginning with awareness. There was a study that I saw that said that about just 31% of individuals were aware of even hepatitis vaccine, and less than 21% were aware of hepatitis B. So it shows that we have a very serious problem on our hands, which the government alone cannot handle, which international NGOs alone cannot handle. They require the work and the support and the coverage of local NGOs in Nigeria. Okay, the areas of awareness for hepatitis will include awareness on the mode of transmission. Okay, awareness on the mode of transmission. Awareness, we need to teach young people that one of the major modes of transmission of hepatitis is through sex, unprotected sex, and teach them against having more. We need to also create awareness on the transmission of hepatitis through mother to child, and also through transfusion of infected blood products. Okay, now how can they support NGOs, local NGOs, in creating this awareness? One way is by subsidizing airtime on government media, Governments, both print and television and radio, just like we saw during the COVID-19, a whole lot of awareness was going on TV, on radio, on newspaper magazines, in the internet. A lot of NGOs were drumming support, educating the masses on COVID-19. Government can do that for hepatitis B, seeing that it is a very serious health condition. And one way they can do that is to subsidize airtime on their media, on television media, so that NGOs, local NGOs, can create awareness on hepatitis, both B and C, which is more common and which has a more chronic cause in our environment. One other way is that they can provide information materials. International NGOs can provide resource materials that local NGOs can use in providing this awareness. Okay, because we are seeing that materials are needed, of course. if we want to do mass campaign on hepatitis, we will need materials. International NGOs can provide local NGOs with these materials. Governments too can also make available these materials and make them accessible for local NGOs to cover areas which they will not ordinarily cover. Another way that international NGOs and governments can play a major role in supporting and assisting local NGOs is in funding. It can never be overemphasized. It cannot be overemphasized. Funding is needed. Funding is needed. Funding is needed in mobilizing resource persons who will go into communities and organize meetings, organize seminars in schools, organize seminars in town hall meetings, organize seminars in market squares, organize seminars in offices. It requires a whole lot of funding. And so international NGOs can provide access to funds for local NGOs to use in carrying out these activities, okay? In carrying out these activities, and governments can do same through partnership, very important, partnership with local NGOs, because we find that local NGOs usually have coverage towards areas that are not easily accessible by the government, okay? And then one other thing that can be done is that international NGOs and governments can also provide testing kits for mass screening. Testing kits for mass screening. It is very vital. It is very important, because one of the things that we have found out, I've been involved in lots of hepatitis screening, hepatitis B and C screening in rural areas in Cross River State and other parts of the country. And one thing that we have encountered is that the materials for the test kits are not easily available. The test kits, and most times they are not sufficient for the population of individuals we want to reach out to. And so one thing that government and the international NGOs can do is to make available these testing kits that local NGOs can use, okay, in testing, in screening people for hepatitis. It is very, very important. It is extremely important that materials are made available, okay? And one other thing that they can do is to subsidize or cut down the cost of vaccines. Cut down the cost of what? Of vaccines. One of the major problems that NGOs or that individuals have encountered is that the cost of vaccines, they are very expensive. And just like Dr. Keliola has spoken, he said that there are three vaccinations for hepatitis B. The first one, the second one, and the third one. And each of these vaccines cost money. And so usually, seeing the economic situation in Nigeria, a lot of individuals will not want to bring out their hard-earned money, over 1,700 naira, 2,500 naira in some locations, to procure this vaccine, because there is indeed hunger in the land. And so what NGOs, international NGOs can do is that, and also the government, is that they can subsidize these vaccines. They can support the local NGOs in pushing forward mass vaccination, mass vaccination. Okay, I think I have a few minutes left. I'll just start one very important part of hepatitis B. I want us to know that hepatitis B can also be transmitted from mother to child. From mother to child. A lot of people don't know that women who are infected with hepatitis B can transmit hepatitis B to their children. And so, but one way that government one way that this can be stopped is if the child can be given the vaccine at birth through the National Program for Immunization Schedule, the NPI schedule, where children when they are giving birth to, they are vaccinated. I had an experience in Lagos. One of my a clients I handled in Lagos, the husband is hepatitis B positive, the wife is hepatitis B positive. They've been managing this disease for a very long time. And then they had a baby. And what Donna found out that it cost about 95,000 naira to get a vaccine and a drug to give to that child. And they told the mother not to, breastfeed the baby till that child was vaccinated, till that child was given interferon, that drug. And so I experienced firsthand how this woman was running around looking for funds, about 90,000 naira, to buy those drugs, to buy those medications, so that that child will not be infected. I saw a question on the chat box which said that, can a man marry a woman with hepatitis B? That is why I brought up this story. Yes, there are people who are married together that have hepatitis B, chronic hepatitis B. With their medication, transmission is very minimal. And so one thing local NGOs and government can do is to subsidize it, because women who have hepatitis B especially can give that to their children, but with provision of resources to get drugs, to get this vaccine, it can reduce the transmission of this virus to their children. So I will be rounding off now for the sake of time. So in summary, I'll say that hepatitis is a major disease of public health importance. It has affected a whole lot of Nigerians, and it is even more infectious than HIV. Over the years, a whole lot of attention have been placed on HIV, and currently a lot of attention is placed on COVID-19. But people seem to forget that their hepatitis is also very infectious. So I really thank this organization for putting this forward to create awareness, to call for advocacy, that people be aware of the danger of hepatitis. And I believe that through this program, we can draw the attention of policymakers, draw the attention of people in high places who can implement this. Thank you very much for having me. I am so grateful, and I wish you all the best. Thank you very much.
Thank you, Thank you so much, Dr. Anoka Joseph. The session was really brief and straight to the point and insightful and also impactful. Thank you so much. We really appreciate your time. We really appreciate the value you've shared, and we believe that we believe that all participants here are getting the best from the sessions. Thank you so much. Thank you so much. Our goal was not to keep you for a longer period of time. However, I will try our possible best to ensure that you get the best and will be timely. So without further ado, we're going to be calling on the next speaker. The next speaker will be speaking on roadmap to a successful hepatitis vaccination, the way forward. The person that will be taking this is Dr. Olukemi Olugbade. So she'll be coming on board, but before she comes on board, I would really love to read read her read her profile. I beg your pardon. Read her profile, so we'll get to know who she is and what she has done, and a lot of things that has been happening, and why she's fit to share with us the roadmap to successful hepatitis vaccination and the way forward. Because from what I have here, I believe too well that she has vast experience, wealth of knowledge on how these things are and how they can be integrated together, and how we can get the best and how we can spread the message. All right. Okay. So okay. I just got a notification that Dr. Kemi is in a meeting presently, so but she'll be joining us. But for us not to keep you, we can go straight to questions and answers. So we can begin to treat the questions on the chat area. So if you have a question, there's one direct question that you've been asking since, and you really want to gain clarity. So we can just attend to it right now while we wait for Dr. Kemi. She's on a meeting, but when she's done, she will join us as soon as possible. I know there's somebody that asked the question, can I get the same hepatitis B vaccine at the same time as other vaccines? Is it harmful to have an extra dose of hepatitis B vaccine or to repeat the entire hepatitis B vaccine series? This question is directed to Dr. Kelly. So Dr. Kelly, please, if you're there, kindly respond to this. I'll be recapping if you really didn't get the question. So Dr. Kelly, are you there? Question has been directed to you. All right, sir. All right, sir. So the question is, can I get the hepatitis B vaccine at the same time as other vaccines? That's one. And two, is it harmful to have an extra dose of hepatitis B vaccine or to repeat the entire hepatitis B vaccine series?
Okay, can you get the vaccine at the same time with other vaccines?
Other vaccines.
Yes, it will depend on the other vaccines. It
Okay.
will depend on the other vaccines that you want to get at the same time. So when it's time for you to get the hepatitis B vaccine, then we'll know which other vaccines you want to take with it, and they will let you know if it's compatible or if you can take them at the same time. But most often than not, you will not be able. You may give yourself a 2 weeks to 4 weeks space before you can take the other vaccines. And is it harmful to have an extra dose of hepatitis B vaccine? Too much of everything is not good. Why do you want an extra dose of the hepatitis B vaccine? Or why do you want to repeat the entire process again? No, it's not necessary. If you've completed the 3 doses of the vaccine, then there's no need to go over the entire process again. So from this question, it feels like you do not know, or you're not sure if you've taken the vaccine before, or if you've completed it, or if you are safe. So what I would advise you to do is go for screening. Tomorrow, Blindfold Foundation in Bicor is doing screening. Go there, get screened. If by grace of God, it's non-reactive, you'll be directed to where you can go for vaccination. And if it's reactive, which I know it should not be, then they'll counsel you and advise you further on what to do. Thank you.
All right, thank you so much, Dr. Kelly, for that timely response. I really appreciate. I hope the person that asked this question is really clear. And also to Dr. Gabriel, what are the difference between A, C, and E? I don't know if they have hepatitis E, and I'm not conversant with that field. So what are the difference between hepatitis A, C, and E?
Okay, thank you once again for having me. I think the person who asked the question actually was getting it wrong. I will try to put the person on that the current known hepatitis that we have is hepatitis A, B, and C. And then he went further to ask what are the differences. I think the differences is just like, for instance, if we say is by type, type A, type B,
Okay.
and type C. And then for us having type B, for instance, that it is the mostly common hepatitis that we know in Nigeria. And this is mostly affected to people because it is transmittable through bloodly infused fluids like sweat. For instance, if someone who is infected with hepatitis B and the person sweats a lot, and in the course of care treatment, if you are not careful, you can easily contact this virus in the person. While hepatitis C is usually has the transmittable process has to be through blood transmission, either with your partner, or if you have any contact with unsterilized equipment or tools. Those are the avenue that you are prone to contacting this virus. Again, let me also put it here that hepatitis A, the transmission, looking at it, is just mainly facial oral. So it's just within the facial area that it can be contacted. So in the course of you going to see the sick one, maybe on the sick bed, you touch, these are the opportunities, or these are the areas that you are risk of getting them. While hepatitis B, contact with blood and other bodily fluids that contain hepatitis. And then C, contact with blood that contain hepatitis C virus. So it is just the difference in the virus, like we have type A, type B, and type C. And then again, the incubation period. Incubation means how old can this virus actually stay in our system. Now, for hepatitis A, it can stay between 15 to 50 days. And then between that period, it is expected that you are able to detect. That is why in my presentation, I talked about early diagnosis, treatment, and management. And then hepatitis B can stay between 60 days to 150 days without any manifestation, it won't show any symptom, you are just there. But C can just stay within 14 to 84 days. So these are some of the things that we should know in the course of educating ourselves, educating the public, and even our household about hepatitis. However, like we've said, It is not well known. It is not, but it's very, very endemic. Not like the COVID, like it's popularly known. We're seeing the NCDC sending us text messages. So these are some of the things that we should take note of. So those are my responses to the question that was asked.
Okay, thank you so much, Dr. Okay, really appreciate that response. There are more questions here, so I'm going to be bringing the questions up now. So somebody asked, can a man infected with hepatitis B marry a woman who isn't infected with the virus? That's the question. Can a man infected with hepatitis B marry a woman who is not infected with the virus? And another question is from Kyoto. Can infected persons still take the hepatitis vaccine? So I don't know, but this should be directed to. Okay. The question the question was not directed to any of the speakers though, but I can call on Dr. ID to answer that for us. Dr. Indodesit, if you're there, please, can you please answer this? Dr. ID, are you there?
Okay, yeah, I'm there. Can I hear the question again, sir?
Okay, thank you very much, sir. Thank you, sir. Okay, can a man with hepatitis B marry a woman who is not infected with the virus? That's one. And two,
Okay.
can an infected person still take the hepatitis vaccine?
Okay, the first question is, can an infected man, okay,
Yes.
get married to uninfected woman?
Yes, sir.
Yeah, then let me start with the first one. Yeah, he's infected, all right. Now, if treated, yes, it's a disease condition that can be managed, all right? It's a disease state that can be managed. What just happened to the person is that he has been infected, all right? So on a normal moral ground, it's not like a sickle, it's not as if it's been incorporated into his genome that its offspring, okay, are going to inherit. It's not hereditary. Do you get what I'm saying? So
Yes.
It is not a hereditary, hepatitis is not an hereditary disease. It's not hereditary, but it can only be transmitted. What I mean by hereditary, meaning that it's been incorporated into your genome, in that your offspring will express that gene. All right. So it's a gene that is being incorporated at the somatic level, not at the germline level. It is only a germline incorporated DNA infection that can be, or mutation, that can be transferred from generations to generation to generation. But that does not mean that since it's infected, if it is not treated, it can as well transfer the disease to the next person, just like it's a communicable disease. All right. But to say in his genome, it has done nothing in its genome. All right. Then the other one you said, what was the second question? Sorry.
Okay. Can an infected person still take the hepatitis vaccine?
If you're infected, you don't need to take the vaccine, you need to be treated. Because the vaccine, what vaccine does is, vaccine does not, vaccine is just an anti-agent. Antibody is just an anti-agent that is being introduced into an individual to like boost or pre-position the person against that particular infection. For example, now you take in something for that thing to go inside your system and restructure your system and build in some fighters against that thing if it comes in. So it's a prototype. So you don't take the vaccine you don't take the vaccine as a treatment. You take the vaccine as a preventive measures. It will not treat. All right. So if you're an infected person,
I guess the network is really bad.
Taking in now goes in, your system has been disrupted already.
So, Dr. ID, please, can you just kindly recap the next, the previous 10 seconds you were actually interrupted. I think the network caused it, so we didn't really get to hear all of those things you said. So I think you can just go over 10 seconds, the last thing you said 10 seconds ago, probably from the last statement. Yeah.
Okay, to recap, what I mean is this: for an individual that is infected, okay, can marry an uninfected person. The truth is this: the infection only happens to the somatic cells. It does not affect the genome of that person. So it does not mean that if it is infected, that is going to transmit it to the gene of his offspring. No, it is not hereditary, but it's a communicable disease. So if he marries a woman who is unaffected, that means it's going to infect the woman, but does not mean that it has transferred it at the genome level. No. So it is not hereditary. All right. Then the other one, there is no need for you to be infected already. You've been tested positive. All right. And you now want to go and take vaccine. Vaccine is not a management strategy of an infected. That means the disease has been established already. So vaccine is only taken on people that has been tested and they are not affected. So when you take in vaccine, vaccine goes inside your system to build up fighters, to build up your immune system against exposure to that particular disease, not after being exposed and it has dominated your system and you now want to take vaccine. So vaccine is not recommended as a diagnostic for treatment. It's only a preventive measures against exposure to that disease. So that is just what I can say. I hope you can hear me.
Loud and clear, sir. I can hear you.
Okay. All right.
Okay. Thank you so much, sir, for that question. The response was really, tangible and straight to the point. So in a nutshell, they're simply trying to tell you that you can get married to an infected person or anybody. Just you can get married. It's something that is treatable. It's something that we can actually treat. So you are still safe even if your fiancé has it. Don't feel no. According to what the facilitators are saying. And also when you have this vaccine, when you have when you have been diagnosed of hepatitis, it is important not that you don't take the vaccine. All you just need to do is to seek for treatment. Seek for treatment instead of taking the vaccine. Medicine after death it's nothing. So when you have been actually diagnosed of this particular illness, what you need to do is go for proper treatment so that they can eliminate that particular illness off you, because that vaccine is meant to protect, to wage war against what can actually, install those things in your system, to wage war. That's why they said, if you notice, according to Dr. Kelly, he clearly elaborated on how you should take it. The first one, I think he said 4 weeks later, take the second one or so, or thereabout. I think we should recap so that we can get to know that. I think he said, Dr. Kelly, can you please help me? The first, because you need to take it 3 times. These are for people that are probably not informed about this whole thing. The first one, you're taking it, then it should come after 4 weeks or 6 weeks, sir.
Now it's 4 weeks after the first dose. You don't need to bother about that timing. You don't need to bother about that calculation. The health worker is. When you go for the vaccination, they'll give you a vaccination card and then they will tell you when to come. So it's not for the public to bother about when they will come. You don't need to bother. When you go for vaccination, they give you the first dose, they'll give you a vaccination card and it will be written there when you have to come. You understand? They'll write the dates when you have to come. You come for the second dose, they'll give you a date with the vaccination card when you have to come for the last dose.
Okay, thank you so much. Thank you so much, sir. Thank you so much. So, and also another question, is it in any hospital we can get access to this hepatitis, or it is in selected hospitals? Is it that we can just walk into any hospital and do the vaccine, get vaccinated? That's one. And two, is it that we have to be tested before vaccination takes place? Because I feel some persons might say, no, I don't want to do the test, just that I will not be scared and all of that. I don't want to be scared. Humans feel what they don't know about doesn't kill them. Nigerians, typical Africans, waiting and no go kill me. So make I just go collect the vaccine, they go my house. So is it that you have to do the test first before vaccination takes place, or you can just go ahead to get the vaccine and with the mind that waiting and no go kill me?
Going for the vaccination without being tested, you're just wasting your time, because what if you already have the disease?
That's true.
What if you already have the disease and you go and vaccinate yourself? It's not going to have any effect on you. It's not going to have any effect on you. So it is mandatory for you. In fact, the proper thing to do, nobody will give you the vaccination without getting a clearance that you are free.
Yeah.
Nobody will vaccinate you. So if you go to Brentford, I'm sure they'll give you a kind of a form or a certificate to show that you're non-reactive before any hospital would vaccinate you. So no hospital will waste their vaccine on you if they are not sure that you have been screened from an appropriate authority. So even if you go to any lab, for example, there are some labs that teaching hospital does not respect, you understand, or do not hold their results. So for example, you go to any of those labs and they tell you that, oh, you are free from hepatitis B, teaching hospital will still insist on you doing the screening over there with them. And it's free over there, not if they'll charge you money for it, just for them to be sure that, okay, this person does not have the disease, so let's vaccinate him so that he will not have it in the future. Then about walking to any hospital for the vaccination, that's how it should be. But we're in Nigeria, so not every hospital has it. So, but if the hospital around you or close to you has the vaccine, good and fine, find out from them. But for now, I'm only aware of University of Calabar Teaching Hospital, Community Medicine Department that has the vaccine. I'm not sure of any other primary healthcare centers that has access to the hepatitis B vaccine. So a little about what I was talking about.
Okay.
What stops other hospitals or other primary healthcare centers to get the vaccines? There's nothing that stops them. It's about interest. It's about going to get it, about being interested, about them being aware of the burden of it, and then make plans, the hospital management, the government and stakeholders to get these vaccines for themselves. So for now, I'm only aware of teaching hospital that I'm sure of community medicine department that can help you with the hepatitis B vaccine.
Thank you so much. Thank you so much, Dr. Kelly. That's really a great one. I really appreciate your response. Okay, for the sixth. Okay, on that question, before we move, is the vaccine free or in public or teaching hospital? Please can this be answered? Is the vaccine free? Is the vaccine free in public or teaching hospital?
In teaching hospital is 1,700 naira per dose, and which I honestly feel it is very relatively cheap, because somebody said that amount is not cheap and it's expensive. Truth is, if you get tested and you're positive for hepatitis B and you do not have symptoms already, at least for example, now you are screened, you have the disease, but you are not showing any symptoms, the drugs you will need to take to suppress the viral load in your body so as not to get the symptoms, you'll be spending about 150,000 every month, and you need to do that for about 3 to 6 months. So I don't know which one is cheaper for you. If the 1,700 is too expensive to get the vaccine, maybe it's the 150,000 naira antivirus drugs that you can take for 3 months that will be cheaper for you to take. So I understand vaccines should be free, government should work hard, but this thing comes from people's pockets. So you can go by yourself, or you should go by yourself and secure your own health. 1,700 is not compared to the money you will spend to reduce the viral load when you finally get the disease.
All right, thank you. Thank you so much, Dr. Kelly. This is him, doctor, trying to tell us that the 1,700 is cheap compared to you running up and down for the problem to be resolved, for you to be whole again, for you to be okay, because we've not even talked about the BP that you might even get from the fact that you have hepatitis already. You're already thinking. We've not even talked about, according to him, saying that can you spend 150,000 to take a certain dose for 3 months? Imagine 150,000 times 3. That's close to a plot of land. So 1,700 for 3 for 3 times is not as much compared to the amount you spend when you finally have this illness. So it is important that you please take note of this aspect. 1,700 is still good as okay. Though yes, we know the government is supposed to actually provide the necessary facilities and structures, things that we need based on, yes, we already understand. But in a third world where we are still in a thriving economy, we're still in a thriving space, let's not go to how the state of affairs is being managed and how things are being done, which is making us to lose a lot of things. Let's not even talk about the government. So you are your own responsibility, first of all. You are your own responsibility. Do you appreciate the life you live? Do you appreciate the air you breathe? Do you appreciate your family? Do you appreciate your friends? So if you really do, and let me not even go too far. Do you appreciate? Are you passionate about the lives you are going to touch when you are healthy and strong enough to actually touch those lives? Because know that when you are ill, when you're not strong, most people's destiny are tied to your purpose a whole lot of times. So we are called for a mission, we're called for a purpose. So you need to put your health, you need to take proper care of yourself. 1,700, yes, might be big, but please, it's still reasonable for you, for your health, than waiting for one government to come and take charge and probably make this vaccine free for you, or for you running helter-skelter to raise 150,000 naira for in 150,000 naira times 3, which is about like 450K, just to solve a problem. All right. So this is very important. Your health, your health, your health. Tomorrow we'll be having we'll be vaccinating and trying to sensitize a lot of persons. You can also come around and be part of it. So the last speaker will not is unavoidably absent. We've tried to reach her, and I think there's a glitch, so she will not be able to make it. And this will actually draw the event to a close. So I'll be welcoming Miss Kyoto to our digital stage to close the conference and to thank everybody for coming. I've played my part. Thank you. Miss Kyoto, you have the stage.
Okay, once again, okay, it's afternoon now. Good afternoon, everybody. Thank you for turning up. Thank you for coming out. Thank you, doctors. Thank you for every resource person. Thank you, our moderator. Thank you, everybody who came out for this sensitization. Okay, I appreciate each and every one of you, and I want to say Brian Fort is happy that you all came out to share your ideas, to share on the topics you were given and all of that. I want to appreciate Dr. Kelly. I want to appreciate Dr. Olukemi. I want to appreciate Dr. Anoka, Idongesit Victor, Mr. Gabriel Adim, and all other participants, our wonderful moderator. Thank you so very much. I appreciate. Thank you for coming out and for sharing your ideas. It has really gone a long way. I've really learned a lot. Okay, so I learned that you should not take the vaccine if you are infected with the hepatitis. Say that a vaccine is not a treatment procedure, but rather it is a preventive procedure. And also we should enable ourselves to go for screening, because health is wealth. If you're not healthy, you cannot affect the next person close to you. If you're not strong enough, you cannot impact lives. So thank you so very much, each and every one of us, for coming out. I really appreciate. All right, over to you, moderator. Thank you.
All right, so we can call it a close. Thank you so much for joining, and thank you. So on your way out of the gate, you can just grab there's a lady at the entrance, so she's with the puff puff and the zobo. So you can just take yours and we'll move. Thank you so much. I really appreciate it. Thank you, Gabriel.
Okay.
Thank you, Kyoto. Thank you, Mr. Dr. Idongesi. Thank you, Dr. Kelly. Thank you, Absalam from Kano. Thank you, Mr. Gabriel.
Thank you, sir.
Thank you, Aminu. Thank you, Muhammad. Thank you to everyone that has supported Brentford Foundation.
Thank you so much.
God bless you. God bless you. We hope to get in touch with you for our subsequent programs like this. Thank you, and God bless you. Thank you.
Thank you.